I'm at Akash Institute, one of the top coaching centers in Sri Vijayapuram. For NEET, JEE competitive exams, then this place is a game changer. Here, faculty have taught thousands of NEET and JEE toppers. 36 plus years of legacy in producing top rankers. और हम यही expert coaching ले आए हैं आपके श्री विजयपुरम. Last year, their students cracked JEE, NEET and Olympiad top rank. If you're aiming for IIT, AIMS or top engineering or medical colleges, Akash Sri Vijayapuram is your launchpad. Admissions open for this year 25-26. For more details, contact us today.
आपके घर के सेफ में, बैंक के वॉल्ट में, ड्रेसर के ड्रॉअर में एक ऐसी चीज है जो इंडिया को स्ट्रॉन्गर बना सकता है, आपका पुराना सोना. तो इस दिवाली क्यों ना उसे ही एक्सचेंज करके नई ज्वेलरी खरीदे. भारत का ऑलमोस्ट सारा सोना इंपोर्ट होता है, लेकिन अगर आप पुराना सोना एक्सचेंज करेंगे तो इंपोर्ट नहीं करना पड़ेगा, जिससे अपना देश स्ट्रॉन्गर बनेगा. आपका पुराना सोना तनिष्क में एक्सचेंज करें और बनाए भारत को और भी सुनहरा.
Hello, I am Dr. Rukayyal Fathima. I am a fertility consultant, gynecologist and a high-risk obstetrician. I practice at Chennai and I am basically a hardcore fertility consultant and a physician. So I have come all the way from Chennai to Andaman mainly to see patients who have difficulties in getting conceived, because fertility has become a lot more global issues. Previously, we were only blaming females, but nowadays males also have become a part of the fertility problems. And day by day, it is increasing. Previously, it was told only around 15 to 20%, but nowadays the fertility issues has increased up to 40 to 50%. And of these, male becomes a part of it in another 40 to 50% of the reasons, and whether female also are a reason in 40 to 50%. But to be very honest, most of the problems are easily diagnosable and easily treatable too. But sometimes because of the lack of accessible healthcare, the diagnosis remains uncertain. So many patients do not know how to reach out to a healthcare. Sometimes a simple treatments can be easily be a solution, but because of the lack of accessibility, they are not able to get conceived faster. So because of which we are here to provide the accessible healthcare. So in kind of females, what are the problems that they could face is there can be any problems with the uterus, their tubes or their ovaries. A simple ultrasound can be able to find out such problems such as a fibroid, a polyp, a septum uterus, and in women sometimes simple problems like polycystic ovaries can be reverted by medicines, or it can also be reverted using a procedure called laparoscopy. In case of males, there are some problems called sperm count. Whenever the sperm count is lesser, we call it as the oligoasthenozoospermia, where simple medicines can revert the problems. A hormone analysis and an ultrasound can easily solve the problems. So such diagnoses are easily made, and around 60 to 70% of the problems can be easily corrected by simple medical management. On some situations, when the simple medical management do not get sufficient, we step up the patients to some treatment called IUI or IVF. In such techniques, what we do is, in case of IUI, we make the women to ovulate and we put the sperms of the husband inside the uterus of the women. Most of the situations they get conceived. In IVF, it is a completely artificial reproductive technique where the eggs are taken out and the sperms are also taken out. Both of them are made into an embryo and then they are put back inside the uterus. So most of the situations, in 60% of the situations, they get conceived. So this is what I'm trying to tell. Most of the procedures have been simplified. So it is very important to diagnose them and then treat them accordingly, according to their needs. Apart from this, lifestyle also plays a very important role. So I would insist all the young women and male to take care of your good sleep as well as eat on time, and then take proper balanced diet and take care of the weight also. Sometimes simple things like reduction in their weight and then good sleep habits, increase physical activity can reduce their problems and make them conceived. So here we are going to treat them empathetically as well as evidence-based, mainly by focusing on their lifestyle interventions as well as to get to the bottom of their right diagnosis and give them the proper treatment. It can be a simple solution like a natural cycle, or even in cases of advanced treatment like ART and IVF can be provided. So such problems can be easily cured, and the problems such as that they do not get baby and they cannot get conceived naturally can be easily reverted. And any such problems, any such solutions, please feel free to contact us any moment. We will also be available for online consultations to help you out in such situations. Second important thing is, lot of women face the gynecological issues starting from simple bleeding. They have lot of white discharge or abdomen pain. In such situations, whenever we do a scan, we are able to diagnose a fibroid uterus or a simple polyp. Most of the problems can be easily reverted through medical management when it is diagnosed at the earlier stage. But many women, because of the family issues or the family burden, they come to a doctor very, very late. So once we diagnose it, we are able to resolve it using simple medical management. There are some problems like a big fibroid or a polyp or an endometriosis or a polycystic ovaries which cannot be reverted by medical management. In such situations, we advise them to go ahead with laparoscopy. And the laparoscopy procedure has become very, very simplified nowadays, where it has become like a daycare procedure. They get admitted in the morning and we can discharge them in the evening, and mild general anesthesia can be given for simple procedures like polyp removal or something like septum resection. Sometimes like advanced procedure like fibroid removal or uterus removal need extra 1 or 2 days stay, but they can be easily done with simple laparoscopy procedures. So their recovery is also very easy. They need not be admitted for a longer time. Their bed rest time also has been reduced profoundly. And most commonly in women, the important thing to concentrate is about the prevention of the cancers. So regular examination by the women is very important, especially after the age of 40 years. So two important things to note down is, one is the breast cancer, another one is the cervical cancer. For the breast cancer, they have to see a simple self-breast examination, or a mammogram can be done once in 3 years after the age of 40. In case of women to prevent cervical cancer, pap smear, it's a simple test which can be easily done on an OPD basis. So it can be done once in 3 years, at least up to the age of 50-55 years. And once it has been negative, after the menopause, they can follow up only once in 10 years. In such situations, we will be able to find out about a cancer very early stage, and the treatment also can be done easily. So I would request all women, if at all you have any gynec issues, any gynec problems, most of them can be simply resolved. So just get a consultation done. Through a simple scan or simple examination, we can find out and revert the problems. So for any kind of gynecological issues, laparoscopy procedures, or fertility treatment and IVF, you can contact us anytime. I will be available at Shifa's Mainland Healthcare. So please, we will give you the phone numbers here. So you feel free to contact us. And for any kind of opinions, we will be available for all kind of gynecological and fertility issues.